Why is light given to him that is in misery, and life to the bitter in soul, who long for death, but it comes not, and dig for it more than for hid treasures, who rejoice exceedingly and are glad when they find the grave? Why is light given to a man whose way is hid, whom God has hedged in? For my sighing comes as my bread, and my groanings are poured out like water. For the thing that I fear comes upon me, and what I dread befalls me. I am not at ease, nor am I quiet. I have no rest, but trouble comes.
Welcome to tonight's episode of Bay Area Psychology. It has been previously observed on our show that, in general, America is a pain-phobic society. We defend ourselves against the tragedy and suffering that enters our lives with medications, addictions, and self-help books promising easy solutions. We see emotional pain as a problem to be quickly solved. In Care of the Soul, Thomas Moore poses the question, what if depression were simply a state of being, neither good nor bad, something the soul does in its own good time for its own good reasons? Then we might see melancholy as a valued way of being rather than as a problem that needs to be eradicated. Tonight, we will examine the term depression, which is broadly used to describe symptoms ranging from the blues to thoughts of suicide. One of my students articulates this range very well. Let's hear from her. Okay, how do you know when you are depressed?
Well, I think it's kind of funny. People lump being depressed, I think it's like three separate things. People say they're depressed when they're just sad. And people say they're depressed when they're frustrated. But I think there's separations between being actually depressed, being sad, and being frustrated. And I can tell all three things. If you're depressed, it's almost not even, it's a non-feeling almost rather than a feeling. You know, just non-anything. You can't cry, you can't think, you can't function, and I consider that depressed, and that's pretty easy to spot. And when you're sad, you know, people always say, oh, I'm depressed, but really I think they mean they're just sad, and I can tell that when I want to cry or when I want to, you know, go tell someone all my problems. And then frustration, people always say they're depressed when they're frustrated. It just means, you know, nothing's going right, and you can't, you know, you can't get a handle on things or things like that, and that's probably closer to depression than sadness, just because you can't seem to do anything.
According to recent research, depression affects as many as 17.6 million people each year. Whether we envision depression as necessary to the soul or see it as a chemical imbalance which is best treated with medication and psychotherapy, to me, 17.6 million people constitutes an epidemic. We are fortunate to have with us Dr. Stuart Kriegel, a psychiatrist here in the local San Jose area, and with us as well is Leah Anascard, a local marriage and family counselor, also practicing in San Jose. Welcome to both of you. I appreciate you being here today.
Thank you.
Okay. As we mentioned in the beginning, I had drawn a reference from Thomas Moore and talked about the fact that there may be times when depression, and we'll talk about the symptoms at a little bit later in the show, but the depression may actually be necessary for people. Has that ever been your experience with your clients?
I think that sadness is certainly something that is a normal emotion and something that we all do experience and probably need to experience to be able to develop as people and to be able to even motivate ourselves to make changes in our lives. I think, though, that if we're talking about the clinical illness of depression, I think that's a more difficult philosophical question. I'm not someone who really believes that suffering for its own sake is necessarily a good thing. On the other hand, though, if a person can go through a depression and feel like they can use that to motivate themselves to make a significant change in their life or gain a greater insight into who they are as people, then I suppose there could be some benefit that would come from a depression.
That maybe at some level, there are those of us who may actually see some benefit or some healing from suffering, that maybe there's some sort of meaning that we need to search for. How about you, Leah? Have you ever seen that experience where somebody did not need medication and decided to go ahead and walk through their depression?
I think I would agree with Stuart in that sense that there are certain depressions that if they're that deep, a person isn't going to be able to walk through them and is going to have that sense of hopelessness. And I think it's kind of unnecessary to have that much pain, that you can still get some meaning and out of the experience. The medication is not going to take away all of the depression, but it is going to get somebody's head enough above the water to be able to decide what's going on here and what can I learn from this experience.
That's an important point, that in fact medication I know with my clients certainly has not taken away all of the feelings that have been affiliated with their struggle and their depression. Okay, well, you know, we do have a graphic that we wanted to draw from in terms of looking at what exactly is this clinical depression you're talking about that needs to be addressed and that is not necessarily beneficial. Why don't we take a look at the first symptom that we have? Persistent sad, anxious, or empty moods. Would one of you like to talk about that? What does this look like in terms of body language in somebody's life?
In my experience, when people are depressed, they will tell you that they really do feel very sad most, if not all of the time. Sometimes anxiety or a sense of nervousness, worrying about everything is part of the picture too. I think some people describe more of an emptiness or a feeling of just not really existing.
Okay.
And I think it can be extremely painful for people to experience this.
Okay, so maybe like the student mentioned, you know, that feeling of nothing, numbness.
Right.
A feeling of I don't know why I'm here, a feeling of I don't even want to get out of bed this morning.
Okay.
That's often what people describe to me.
Okay.
I don't get any pleasure out of anything anymore.
Okay, yeah, you're talking about that. I know one of the symptoms is a sense of lack of pleasure, lack of response to things that perhaps used to be a source of pleasure.
Mm-hmm. Mm-hmm.
Let's take a look at another one of our criteria. Feelings of hopelessness and pessimism. Maybe the sense that it's not going to get better. Is that what you have heard from people, that this is the way it's always going to be?
This is the way it's always going to be, and this is the way it's always been, too. Sometimes depression feels like it's been there forever, and they have a hard time remembering that maybe a year ago or 6 months ago things were actually better.
Okay.
But once you're in that darkness, it feels like it's been there forever,
Okay.
and it's going to be there forever.
I agree with Leah, and I think that also that's one of the things that tends to interfere with people actually going and seeking help, because they feel like, what's the use? I'm stuck with this. This is just the way I am, and it's never going to get better.
Okay. Now, how do you intervene with somebody who comes in presenting that this is the way it's always been? How do you give someone hope with that particular symptom?
Sometimes it's a struggle because the mental thought process of somebody who's depressed is very negative and very pessimistic. But really trying to let them know that this is an illness, that this is about the brain chemistry being out of whack. Sometimes that medication can really make a difference and can make a difference pretty quickly.
Okay.
So
As well as talking therapy also, which can also make a difference.
Okay, so being able to label the difficulty and saying, you know, this is a disorder and this is treatable versus, you know, people walking around in the world saying, well, this is just kind of the way I am.
Yeah.
I know there are lower levels of depression called, in particular, I was thinking of dysthymia, which feels to people like, at least for 2 years, they have almost been walking around in a sense of a gray cloud, is how I've heard it described. Maybe not so depressed that they're not functioning, but just sort of feeling, you know.
Yeah, I can comment on that because I do see a lot of people who suffer from dysthymia, and I think the way they explain it is they just feel like they're not really enjoying life as much as people around them seem to be. They do feel a low-grade sense of sadness, just not really feeling, usually for years at a time, or sometimes even for their entire life, like they've really been able to experience happiness.
Okay. And so and then that would be normal. In fact, if this was part of a family situation, maybe other members of the family may have a similar outlook on life. And so it would be hard to even know that I'm depressed versus this is just the way people are.
It's true.
Yeah.
They do think it's normal for themselves, but there's also sort of an inner question that says, is this all there is?
Okay.
You know, it seems like there ought to be more.
Is that what brings people in to see you, do you think? That sense of, you know, is this all there is?
Sometimes. I think, though, sometimes it's a crisis that's brought them in, and it's around another issue, around a work stress or around a family crisis of some kind. And then in the process of examining how they are trying to resolve that situation, you begin to uncover the fact that they have this depression that they've just sort of figured that's normal and that's the way I am, and there's nothing that can be done about that.
So it's possible for me to walk in and be talking to you about my marriage and for us to discover that, in fact, I have a depressive disorder.
That's right.
So in that point, do you see people resisting that depression diagnosis? I mean, would they rather have a marriage problem than to say, you know, gee, I'm struggling with a disorder, or are they relieved? What's your experience with that?
I think in our society, a lot of people would prefer to be having a marital problem or some sort of problem at work than to have someone tell them that they may be suffering from a mental illness, because we still have a stigma in our society to a great extent, whereby people feel like those who have mental illnesses are really totally out there. And they're, I think, worried that people are going to look down on them. And I think part of our job as professionals is to educate the public that having depression is not any sort of indication that you have some sort of character weakness or that you're just a weak person. These are illnesses that, for the most part, can be very successfully treated, and the person can usually get a lot of relief from the sadness or just loss of pleasure that has been characterizing their life.
In fact, you make an excellent point, you know, as you both know, and I don't know if our viewing audience knows or not, but that when you go into a counseling situation, often if you wish to use insurance, you do need to provide a diagnosis. And I did have somebody say to me the other day, well, I don't know if I want to use my insurance because, you know, once people find out I have depression, that'll follow me the rest of my life, and really tapped into that whole belief that there's a stigma attached and that this will be something really bad about me should people discover it.
People, I think, also feel that a mental illness, it should be a mind over matter thing, and that I ought to be able to control this. I ought to be able to do something different or think positive or just think positive thoughts.
So somehow I should be able to control this.
And I should be able to do it on my own.
You bet. We're going to take a break. When we return from our break, we'll hear your experience of depression in our segment, In Your Voice. Stay tuned.